Really. Good afternoon, Sherry.
Hi.
Delight that you're back here again, and we're sitting down and we're going to review after 3 months of therapy. As we take a look, we are going to go ahead and review on the areas of concern that we're treating. As you recall, you have what they call a rotatory scoliosis. This is a curvature that goes in kind of an S shape, in which you have a right convexity in the mid-thoracic region going to a left convexity in the lumbar region. As we take a look at this, we know that we had quite a bit of work to go ahead and try to stabilize these areas. Originally, when you came in with a number of complaints. The initial being on a system, as we review them, will be your bowels. You had trouble with your bowels for a while, dealing with the neurological implications from the scoliosis for years. Can you, right now, do you have normal movement now?
Yes.
Okay. You also complained of mid and upper pain in these regions. Now, primarily, again, following that S-curve on the right, on the mid to upper thoracic region, and on the left on the lower or lumbar region. And the musculature dealing with these regions actually radiated and created a musculoskeletal imbalance throughout this, along with on the left side of shoulder and neck pain. Now, you rated those on a scale of 8 to 9 at times, depending on the time of day and the level of activity. You were also quite stationary, according to my notes, that you had trouble even to the point of walking distances. How has the treatments affected you in these regions?
Oh, I'm definitely not as stiff. I'm not as stiff as I was. I'm like more regular in the bowels. I crack a lot more easily because I'm not stiff.
What do you mean by crack?
Well, when I move and stuff, it sometimes just cracks on its own, and that is amazing, because before you're just locked. You're just locked. And so it's the pain is, I don't have anything like I used to have, and I'm not stiff like I was, and it's just, there's a lot of improvement. And I don't get the frequent headaches that I got, which I think were associated with the neck and the shoulders. And so it's definitely much better.
On a scale, how would you rank? Now, you said crack, and actually there's no such thing as cracking. It's just nitrogen gas between the joints releasing pressure.
Okay.
On a scale of 1 to 10, because you had such a deficient lack of mobility in your ability to move in locomotion before coming in for treatment. After 3 months of treatment, how much more distances can you walk if you do walk farther? And how would you rank your pain if it was on an 8 to 9 when you originally came in? What is it today?
Oh, okay. I would say maybe 3, and that's off and on. Depends if, if you're too tired or circumstances, not getting enough sleep, too tired, or something stressful happens.
So intermittent, in other words, from constant. Okay.
Yeah, and that's just from circumstances or whatever. But and then walking and stuff, I can definitely walk longer, and I just went hiking a couple weeks ago, and I was fine.
Excellent.
I was absolutely fine. In fact, I wanted to keep going.
Excellent.
Yeah, that's great.
Well, that's really exciting news.
Yeah.
That is very exciting news. As we take a look at here, Sherry, I want you to go ahead and I want you to take a look at, you also had some pain along the lower back region and into your sacrum, which radiated at times down into your buttock region. Now, the other day, when we were talking, you haven't mentioned that in a matter of, I'd say a couple months.
Mm-hmm.
And I asked you if you're having any pain in that region at all. How long has it been?
I think it's like you said. It's been months. I mean, I don't really remember.
Oh, okay. That's really good news. And what is your expectations as we progress the next 3 months of therapy? What are your expectations and your goals for treatment?
Well, like when I went swimming and stuff, normally, you know, in a bikini you can kind of see the back shape and stuff, and what you've done is where it was higher, you flattened it. It's much more flatter. Everybody said it. Everybody's noticed it, and so it's nice to, you know, be in a suit and not be worried about what it's looking like. So I mean, physically you can even actually see it, you know, changed and different, and everybody said it. So going forward, it's just going to get better. It's, you know, it's just going to get better.
So what you're saying is just from a cosmetic point of view, in someone just looking at you without any medical training, they're noticing a posture that's improved.
Yes.
Well, that's great. That's exciting, Sherry. But what's even more exciting is the ability to move freer now.
Yes.
And the ability to do things you couldn't normally do.
Yes.
Before therapy.
Yes.
Well, thank you, and I'm looking forward to the next 3 months.
Yeah, and I recommend a lot of people to you, too.
Thank you, Sherry.
Okay.
All righty.